Let's talk about metformin. Metformin is a generic name of a medication, and glucophage is actually the brand name. The brand name may vary based on what region you're in, but a doctor will most likely refer to the medication as metformin, your doctor or your healthcare provider. Now, metformin will be prescribed as a first-line treatment for adults and children, and when we say children, we mean children ages 10 and older with type 2 diabetes. And type 2 diabetes is when the body is not producing enough insulin, and that's when you'd have type 2 diabetes. And also if your hemoglobin A1C levels are greater than 6.5%, and I did discuss hemoglobin A1C in my previous video regarding blood glucose, regarding blood monitoring. Additionally, too, if the kidney function test, and the test that we use for that is abbreviation GFR, if that is greater than 30, then it'll be safe to prescribe it for you. Additionally, it's encouraged to be used with diet and exercise. So metformin is not only used to measure type 2 diabetes, but it works along with diet and exercise. Now, let's look into some common side effects because it's not always smooth sailing. The most common reported side effect is nausea and vomiting. However, this usually resolves in 2 to 3 weeks. So I know it may be a bit aggravating to deal with this symptom while you're trying to control your situation, diabetes, but taking the medication with food, if that's something that the provider says it's okay, or having a snack, shortly after. Also chewing gum, sugar-free gum, make sure it's sugar-free gum, could also help with nausea. Diarrhea is also a common side effect. Additionally, vitamin B12 serum levels may be lowered because of this, so you will find that your doctor will probably do blood work and include your vitamin B12 levels to make sure that this is not lowered because of an adverse effect of the medication. Additionally, there's this thing that's called metformin-associated lactic acidosis, and this is related really to in patients who have renal impairment, so that your kidneys are not working at 100% or as they should, or also with advanced age. And when we say advanced age, we're really talking patients who are over the age of 65 years old. Now, the American Diabetic Association is a entity or group that does provide research studies and recommendations regarding diabetic management. And what is suggested is that the A1C level, which we discussed earlier, to be monitored at least twice per year in patients who are meeting treatment goals or who have a stable glycemic control. This means you go to your doctor, your A1C levels are good, the doctor's like, we're within range, everything's going that well, and they probably say, see you in 6 months. While if the A1C is not being managed or you're not reaching the goals that were set with you and your provider, you may have the glycemic level be monitored quarterly as compared to twice per year. And one of the things is that a doctor will provide a diabetic screening. There will be some education and follow up on your results. And then will work with your doctor to let them know what works for you and what doesn't. Because even though we're trying to give this medication to treat diabetes, at the end of the day, it also has to adjust with lifestyle. So be honest about, what you can and can't do, what accommodations you have. Maybe you can't go to the gym twice a week, but you know what? You could walk back and forth up the road. What accommodations can you do so that we can work together to create a plan that could get us to the number that we want to manage our health. Now, here are some things to remember. Now, the FDA, which is the Food and Drug Administration, hasn't recommended a maximum dose. However, typically what they recommend is that the dose in a daily dose should not be greater than 2,550 milligrams in adults and pediatric patients. So even if a doctor may say take 500 milligram twice a day or 1,000 milligram twice a day, the maximum dose is recommended not to go higher than 2,550. So if you miss a dose, or let's say you find that you want to get a higher management, missing dose is different from doubling up on your dose when it's not prescribed. So do talk to your provider about this. There's an XR right here, means extended release. So it means that it stays in the body longer and takes a longer time for the levels to be seen. So that max dose is 2,000 milligrams. And your doctor will assess your renal or kidney function before they start you on this medication. Because, medications are processed through the kidneys, and we just want to make sure that everything is good before we give you this medication. Now, as you can see, here are some This is metformin. So it depends on one, the dose. It depends on where you are in terms of what brand you are prescribed. But metformin does come in different color. So one of the things is that it may be a different color than the one you got like 3 months prior or a month ago. Just be sure to check with your pharmacist to just make sure that you are getting medication that you know of. Or if the color is different, just see clarification. Alrighty, so thank you for watching, and I hope you have a great day, and I hope everything goes well. And let's try to see how best we can manage our health and do the best we can. Take care. Thank you. Bye bye.